And I noticed that there's been a lot of friendly advice offered all across town. Mitch McConnell, John Boehner, Karl Rove, they're all warning you of the horrendous impact if you support this legislation. Now, it could be that they are suddenly having a change of heart, and they are deeply concerned about their Democratic friends. They are giving you the best possible advice in order to assure that Nancy Pelosi remains Speaker and Harry Reid remains leader and that all of you keep your seats. That's a possibility. But it may also be possible that they realize after health reform passes, and I sign that legislation into law, that it's going to be a little harder to mischaracterize what this effort has been all about. Because this year, small businesses will start getting tax credits so that they can offer health insurance to employees who currently don't have it. Because this year, those same parents who are worried about getting coverage for their children with pre-existing conditions now are assured that insurance companies have to give them coverage this year. Because this year, insurance companies won't suddenly be able to drop your coverage when you get sick or impose lifetime limits or restrictive limits on the coverage that you have. Maybe they know that this year, for the first time, young people will be able to stay on their parents' health insurance until they're 26 years old, and they're thinking that might just be popular all across the country. And what they also know is what won't happen. They know that after this legislation passes and after I sign this bill, lo and behold, nobody's pulling the plug on Granny. It turns out that, in fact, people who like their health insurance are going to be able to keep their health insurance, that there's no government takeover. People will discover that if they like their doctor, they'll be keeping their doctor. In fact, they're more likely to keep their doctor because of a stronger system. It'll turn out that this piece of historic legislation is built on the private insurance system that we have now and runs straight down the center of American political thought. Turns out this is a bill that tracks the recommendations not just of Democrat Tom Daschle, but also Republicans Bob Dole and Howard Baker. That this is a middle-of-the-road bill that is designed to help the American people in an area of their lives where they urgently need help. Now, there's some who wanted a single-payer, government-run system. That's not this bill. The Republicans wanted what I call the Fox's Guard, the henhouse approach, in which we further deregulate the insurance companies and let them run wild, the notion being somehow that that was going to lower costs for the American people. I don't know a serious health care economist who buys that idea, but that was their concept. And we rejected that. Because what we said was we want to create a system in which health care is working not for insurance companies, but it's working for the American people. It's working for middle-class families.